Good afternoon, everyone. I'm Jennifer Rice Epstein. I'm the Public Affairs Specialist with the City of Long Beach. I'd like to thank everybody for coming out today. I'd like to welcome everyone in today's briefing on coronavirus. I'd like to thank the Health Department for hosting us, and I'd also like to acknowledge Herlinda Chico from Supervisor Hahn's office. Thanks so much for coming out today. I'd also like to thank Acting City Manager Tom Modica for being here, and Mario Cordero, the Executive Director for the Port of Long Beach. I'd also like to thank some public safety officials that we have with us today, Deputy Chief Ray Tui from the Fire Department, and we have Commander O'Dowd from Police Department, and Francisco Soto, who is the Disaster Preparedness Officer for the City of Long Beach. Today you'll be hearing from Mayor Robert Garcia, City Health Officer Dr. Anissa Davis, and Communicable Disease Controller Emily Holman. After the presentation, you'll have a chance to ask questions of our presenters as well as public safety officials here today. If you're tuning in via Facebook Live, add your questions to the comments section and our health department will respond in the comments. Now I'd like to welcome Mayor Garcia, who's going to say a few words.
Thank you, and thank you all for coming to this briefing. I know that this is a really important topic right now, not just here, of course, locally, but certainly across the country and globally. We know that a lot of people across the city and really the region have a lot of questions and concerns as it relates to the coronavirus. And we really want to make sure that people, especially here locally, know what the city is doing. Know that our public safety team is on this issue and discussing it every single day, all the time, and what really we can do as a community to kind of address this issue holistically. I want to say first, it's very important to note that Long Beach is prepared, and we are aggressively monitoring all the developments that are happening in California, across the country, and of course, really around the world. Long Beach is a global city. It's a city with its own airport and a port, which is the second largest container port in the United States. And so that in particular is of interest to us, and we're going to discuss that a little bit today. This is a global public health crisis, and we have to take this very seriously. We do know that the governor addressed this issue today here at the state level, and we're very grateful for that, and we're very confident that the state is doing everything that they can. But in order to address this issue precisely, cities, counties have to also partner and get involved. Now, we know that there are currently no confirmed cases of the coronavirus here in Long Beach. I think that is important to note, but we're not taking anything for granted, and we're working very hard. The city is currently in constant communication with the Center for Disease Control and Prevention, the CDC, and that is happening on a regular basis, and we're getting updates and reports daily and multiple times a day. The California Department of Public Health, the LA County Health Department, our local hospitals and emergency rooms here in the city of Long Beach, our urgent care centers, and so we're also communicating with all of them. All of our local providers so that we can ensure that we're all communicating, and our university partners, schools and colleges, so that they are aware of what the risks are and what we're doing. We're also pouring all of our resources into keeping Long Beach safe. So what are we doing currently, and what are we going to do? We have set up an incident management system within the city to deal with this as we would with other possible emergencies. We are operating our Health DOC, which is our Department Operations Center, which is kind of a joint command operations center for the city to monitor this. And we're tracking a significant amount of data that is coming in on a regular basis, really worldwide data that's coming in. But we're being very proactive. So the Long Beach Airport, for example, is undergoing extra cleaning, maintenance, and disinfecting of any areas across the airport. That's something that we are doing actively. I will say that we're making sure that hand sanitizer and cleaning materials are being made available in every single public facility, especially those that is of high interest to the public. We're working with our major employers and businesses to give them workforce guidance as well. And as it relates to the Port of Long Beach, our chief executive here is from the Port of Long Beach. There is a lot happening as it relates to the port. As you're probably aware, this is affecting worldwide cargo. But most importantly, it is also changing some of the process that's happening at the Port of Long Beach. Currently, vessels that are coming in with workers from China are being asked to remain on the ships. They are not leaving their vessels as in the past there was opportunity to do so, and that is being monitored by the port closely, as well as our federal partners. So these steps are aggressive and certainly appropriate, but we also want to make sure that we are following some of the basics, and that is to ensure, I ask particularly the folks here in Long Beach to be vigilant, to understand that we should be washing our hands with soap and hot or warm water. We got to make sure that we're not touching our eyes, nose and mouth with unwashed hands, that we're sanitizing appropriately, and most importantly, if you are sick, please stay home. And before I turn this over to Dr. Davis, I just want to also let the community know that the city is taking this very seriously. I am taking this very seriously, and I think this is a global health crisis that we have to be engaged, and I ask everyone to stay engaged and to communicate with their family and their community. And so I'd like to turn this over to Dr. Davis, who is going to give us a little bit more of an update.
Thank you, Mayor Garcia. Are you able to hear me okay with the microphone? Is it okay? Okay, thank you. So I'm just going to read some remarks about the situational update globally, and then here in Long Beach, nationally, and in the state. And then we'll kind of go over what Long Beach is doing, and then I'll turn it over to Emily to kind of get into some more details. So the respiratory illness COVID-19, which was formerly known as 2019 novel coronavirus, has quickly spread after originating in Wuhan, China, in Hubei province in December 2019. There have been over 81,320 cases and 2,770 deaths reported globally. The vast majority of those cases are within mainland China. While the number of new cases within China has plateaued and begun to decline, there has been a sharp increase in cases outside of China in countries such as Italy, South Korea, and Iran. Currently, there are 15 cases of COVID-19 confirmed in the U.S. This number does not include those U.S. residents who were repatriated on chartered flights, nor does it include the U.S. residents associated with the Diamond Princess cruise ship. Locally, there are no cases in Long Beach. There is one case in Los Angeles County and one case in Orange County. Of note, yesterday, the U.S. Centers for Disease Control and Prevention confirmed the first case in the United States of possible community transmission of COVID-19 in California. The individual, a resident of Solano County, had no known exposure to the virus through travel or close contact with a known infected individual. Over the past several weeks, Long Beach has been monitoring travelers returning from mainland China for 14 days after arrival to ensure they do not develop symptoms of COVID-19. Those who are undergoing monitoring are required to avoid school and work and are asked to stay at home for the duration of the 2 weeks. To date, we have received notice of 64 travelers and have actively monitored 8 individuals. None of these individuals have developed symptoms at this time. The number of travelers returning to China has greatly decreased in recent weeks, as most people who desire to return to the U.S. from China have already done so. Because of the expanding nature of this outbreak globally, the CDC has announced that the U.S. could eventually see sustained community spread of COVID-19. While the outbreak is not currently considered a global pandemic, both the World Health Organization and CDC have noted that it could reach pandemic levels. At this time, public health response is focused on the goal of detecting and minimizing introductions of the virus into the United States so as to reduce its spread and its impact. To that end, the Long Beach Department of Health and Human Services has ramped up many of its preparedness activities. Our department's Public Health Emergency Management Program plans for various disasters on an ongoing basis, including pandemics. When the H1N1 flu pandemic hit in 2009, we were able to effectively contain the number of illnesses with mass vaccination and public health measures. So we'll be able to take that experience to combating COVID-19 here. Our staff is prepared to activate mass vaccination clinics known as points of dispensing, where we give hundreds of flu vaccines in a short amount of time out in the field. These responses are exercised on a regular basis. We work very closely with our partners locally and in the region to ensure that we are ready to respond to any public health emergency. So now I'll turn it over to Emily Holman, our communicable disease controller, to discuss our health department's COVID-19 preparedness and response activities.
Thanks, Doctor. Okay, we are doing a great deal of work right now to prepare in case this does become a pandemic. Just some of our activities include, we're working very closely with our medical facilities, so our hospitals, our emergency departments, our urgent cares. We're in constant communication with them, answering questions, clinical questions, evaluating patients who may qualify for COVID-19 testing, things like that. We're hosting a meeting here next week with our hospitals, our infection preventionists, and our emergency departments to discuss updated guidance and answer questions for them. Another thing is we're staying up to date. So this situation is rapidly evolving, and every day there's new guidelines or new publications that come out with more information on this virus. And so we have daily calls with CDC, with the state, with the California Department of Public Health, and even with our neighboring jurisdictions, with LA County and Orange County, to discuss changing guidelines and how we implement those in our own cities. Day and night, we are reading the most recent publications that come out on a daily basis to try and understand the disease better so that we can apply that into our control efforts as well. And like Dr. mentioned, we do have pandemic plans in place. Our public health emergency management, they plan for this even when there's not a pandemic looming. So we're just looking at that extra carefully right now, and we are updating that constantly. In terms of working with our Long Beach City departments, again, we're keeping them updated. Just this morning, we had a call with the Ports Risk Management to discuss, if this does become a pandemic, where does that lead us? What does that mean? And like Mayor Garcia mentioned, in our city departments, we're now providing hand sanitizers in places where there's the most public interface. We're getting in contact with our business partners in large event venues to discuss mitigation planning and preparing for worst case scenarios. Finally, we do have a great website up. I just wanted to plug that, longbeach.gov/COVID-19, but it does have the most updated information. We keep a daily case count for the US, California, and locally, and we do have information for both providers and the public. And finally, we continue to plan for the worst case scenario. And among our staff, we do have the expertise and the ability to prepare for this pandemic. With that, I'll turn it back to Dr. Davis with the final message.
Thank you, Emily. So there's a lot that's still unknown about COVID-19. Currently, there's no vaccine for this virus, and there's no therapeutic medications to treat it. However, we do know that making sure you wash your hands frequently, that you're covering your coughs and sneezes, that you're staying home when you're sick, can lessen your chances of getting this respiratory virus as well as other respiratory viruses. Getting a flu shot is important to prevent that respiratory virus. And if you don't have respiratory symptoms, then a mask won't prevent you from getting sick. So if you don't have symptoms, you don't need to wear a mask. The Long Beach Department of Health and Human Services will continue working with our city department partners and other local stakeholders to address the possible introduction and spread of COVID-19 in our community and ensure the health and well-being of our residents. Thank you.